Dr. Joseph Mercola should promote breast self-examination because it can be positive for patients. They should have available to them the many different approaches to taking control of their own medical options with truth and alternative research. Patients should be checking their breasts at least once a month to ensure the beginning signs of breast cancer are caught at an early stage. Mammograms have not shown much progress in cutting down the death rate with breast cancer patients, so instead, they should use alternative options with the thermographic breast screen. Dr. Joseph Mercola is an alternative physician that is currently practicing in Hoffman Estates, Illinois. He was educated at the University of Illinois at Chicago, Chicago College of Osteopathic Medicine, and is a state licensed physician and surgeon in Illinois. He is a successful New York Times best-selling author with works such as The Great Bird Flu Hoax and The No Grain Diet. Mercola believes that patients should have the availability to seek many options, truth, and alternative practices for the help that they are seeking from the medical system. BreastCancer.org is a nonprofit organization that wants to help patients receive current information on breast cancer. The site has a professional advisory board that looks over the articles to ensure the most current and correct information is put up to the public. The page called U.S. Breast Cancer Statistics was last updated in October of 2012 and has a statistic about women under 50 years old and the risks of breast cancer decreasing since about 1990, which was thought to be caused by increased awareness. Breast cancer is not something we have fully figured out, and I believe the best way to save the mothers, daughters, and other family members from finding out that they have breast cancer too late is to educate the world about self-examination. Everyone needs to know the different alternatives other than having a mammogram done yearly or relying on their physicians to spot breast cancer on time. There is a page also on breastcancer.org called Breast Self-Exam, last edited in September of this year. This explains that the breast self-exam may not always catch the breast cancer early, but is still a great tool for women. And if done every month, women will learn what their breasts are supposed to look and feel like. Statistics to this date in the United States, only 20% of women who have a suspicious lump biopsy turn out to have breast cancer. This statistic shows that there is no need for patients to automatically assume they have breast cancer if a lump is found. And the best thing to do is have the lump checked out with the many alternative options. Whether they choose to go the mammogram or the thermographic breast screen route is up to that individual. If women are more educated about the risks of false positives, they will be more willing to get to know their breasts better, and breast cancer will be spotted before it spreads. If prevention techniques such as breast self-examination is spread among patients, the normal lumps will not be mistaken for breast cancer anymore, to where the patient is putting themselves in more danger with the false positives. The American Cancer Society is a community-based voluntary health organization that has been nationwide for nearly 100 years. They also have a board that looks over all the information before it gets put on the website to ensure the currency of the articles and that the correct facts are made public. On the American Cancer Society's website, the article Can Breast Cancer Be Found Early? Has a lot of information pertaining to mammograms, MRIs, and breast self-examinations. Although this organization believes mammograms are a necessity, they have a tab that lists the limitations of mammograms and says that patients with a higher risk should have an MRI on top of it. The American Cancer Society also states that mammograms cannot prove that an abnormal area is cancerous, so a biopsy will have to be done by taking a piece of tissue from the breast and examining it. I believe that this causes the fear in patients because they will have to undergo a procedure before they even know if the abnormal marking found by a mammogram is cancerous, and that is why breast self-examination is important, because the patients will know their bodies better than the physicians and will be able to stop the false positives. Although breast self-examination has not been proven to lower mortality rates, I believe that if we educate patients about checking themselves for breast cancer, it will help them to understand that there are going to be lumps and natural abnormal bumps in their breasts, and that does not necessarily mean that they have breast cancer. If patients continue to practice breast self-examination, they will begin to know what their bodies look and feel like, in turn giving them more control over their situations instead of having to rely on their doctors who may not notice anything abnormal. Komen is an organization started by Nancy G. Brinker, who promised her sister Susan G. Komen, who was dying from breast cancer, that she would do anything in her power to end breast cancer forever. The Susan G. Komen organization supports giving women all the tools they need to attempt to prevent breast cancer or detect breast cancer as early as possible. The Susan G. Komen organization has had its fair amount of scandals, including the statistics about where the money raised is actually being put to work. A lot of the money is being put towards education and awareness of breast cancer, which they believe could help cure breast cancer. Website breast thermography is based on a medical center called the Pacific Chiropractic and Research Center for Infrared Imaging. William Amelou has 21 years of thermal imaging experience with the consultation of Dr. William Hobbins. The center has over 40 years of clinical research in thermographic analysis and interpretation. On the website, they have a compare and contrast chart called Mammography, Thermography, Ultrasound, What's the Difference? What I found about mammograms compared to thermographic screening is that mammograms miss 20% of cancers in women over 50 years old and miss up to 40% of cancers in women under 50 years old. Compared to thermographic screening, only missing 10% of all cancers in all age groups, mammograms use X-rays to produce the image of the breast that will have to be interpreted to find the abnormal areas. Thermographic screening uses infrared sensors to detect heat and increased vascularity as the byproduct of biochemical reactions. Unlike mammograms, this system relies on the computer to find the abnormal areas, which eliminates the difficulties when attempting to read a patient's dense breasts. The Pacific Chiropractic and Research Center for Infrared Imaging also has a page to describe what thermography is. It's called What is Breast Thermography? This page has the basics about thermographic screening, which includes the research center's opinion of why it is better than mammography screening and MRIs. They say that mammography and MRIs rely primarily on finding the physical tumor, while thermographic screening finds the beginning signs of a tumor, such as heat production and increase of blood circulation. Based on the research I have done, I believe that thermographic screening is the safer route compared to mammography, and could not do any harm to be checked yearly for abnormal signs of breast cancer. Patients should take the alternative route and choose thermographic breast screening rather than mammograms because of the risk factors that mammograms have, including the small dose of radiation they give out during each screening. I also believe that patients that have dense or difficult to read breast should go the thermographic route because it has little to no difficulty reading all ages and types of breast. Although thermographic breast screening is, in my opinion, the better route for patients, they should still consider checking themselves monthly by self-examination. There are many new technologies and techniques that doctors are beginning to try out, and the doctor will never know you as much as you know yourself. Dr. Joseph Mercola should promote breast self-examination because if done correctly and as an educated patient, they can prevent the false positives that a mammogram can cause. Patients should have all the information about the alternative options to taking control of their medical situations with all the truths and information on alternative research that is being done to help find breast cancer before it spreads. Mammograms can do more harm than good based on the radiation they put out and should not be used, especially because they lead to false positives and unnecessary biopsies. Thermographic breast screening with the additional breast self-exam should be used in place of mammograms.